And we're going to start by looking at the evolving relationship between music and medicine, because the relationship between music and medicine did not start with the formation of the band N.E.D. in 2008, of course. It started several thousands of years ago, probably dates back to the very origins of music and medicines as their independent fields. So I like to think of music and medicine as opposite ends of a spectrum, really based on science and art. So we can think of science and art as a balance beam, if you will, and there's times in life where we lean more on the scientific side to help us address a difficult issue or a question, and there's times in life where we lean more on the artistic side. But ultimately, it's a balance between science and art that helps us move forward and address life as we move along. Now, medicine as a field probably falls closer to the scientific side. Music probably falls closer to the artistic side, but there are very important overlapping relationships that exist. Specifically, music as a science and medicine as an art. And because these are more of the far-reaching relationships, I want to take a minute and look a little bit deeper into these relationships. First, music as a science. In 500 BC, Pythagoras, a very well-known Greek philosopher who is an expert in music and mathematics, described the mathematical exactness of tone. He performed a series of experiments where he took different lengths of string, struck the string, and realized you could get the same exact reproducible tone every time based on the length of string. What he showed us was there's a very scientific foundation to the creation of musical notes. He was able to assign exact numerical values to those lengths of string, and it's really led to the creation of the musical notes that we use every day in modern music, the chromatic scale and the Western musical notes that we're very familiar with. So it really shows a very important scientific basis to the formation of music and creation of music. Medicine as an art probably dates back to the origins of medicine as well, but it was in the 1800s that some of the very prominent physicians at the time became more vocal about this and started talking about this. Sir William Gull is a very well-known prominent physician from the 1800s and was quoted as stating, "Medicine requires not only the intellectual cultivation of a science, but the patience and practical skill of an art. At the bedside, we must be animated by the feeling of faithful artisans." He goes on to describe the importance of the artistic approach in the healing process. Now you can see this quote was taken from a JAMA article, the Journal of American Medical Association, from 2007. So even though the quote was made in the 1800s, it's being published all the way up to 2007. Now more than ever, we're realizing the importance of the artistic approach in the healing process. Well, putting it together, music, medicine, science, and art, we published this example in 2009, and I think it really is probably the best example I can think of to really show the relationships between music, medicine, science, and art. On the left-hand side of the screen are rhythm strips from a patient that has hyperkalemia. On the right-hand side of the screen is a musical written notation of what this may look like if it was written out as sheet music. The first thing that I notice when I look at this is that written music is really nothing more than a scientific graph. We have an x-axis and a y-axis. We have data points on the x and y-axis. And as musicians, we're asked to interpret that data and then present it to an audience. And that is the artistic interpretation of a scientific graph. Now, what's really interesting is no two musicians will play this piece of music exactly alike, even though it represents exact scientific data. That's because musicians bring to the table their different experiences, their different talent, skill sets. They bring to the table different ideas, different moods that they're in that particular day. And that's okay, because that is the artistic touch that we need, the humanistic touch that we have in music. Now, moving over to the rhythm strips. This is a patient that has hyperkalemia. Hyperkalemia, if you're not familiar with it, is a potentially life-threatening illness where you have very high levels of potassium in the blood. When I first showed these rhythm strips to my colleagues in 2009 when we published this example, most of my colleagues correctly identified these rhythm strips as hyperkalemia. Very few actually stated that this is a patient with hyperkalemia that needs immediate medical attention. As physicians in the hospital, we're bombarded by scientific information every day, whether it's rhythm strips, laboratory values. We really see a lot of scientific information. But what's really important is how we interpret that scientific information. So just as a musician needs to interpret a scientific graph, so does the physician. And so I think that really brings home the point that both music and medicine have very strong foundations in art and science, and they're actually very similar. Well, music and medicine have come together several times in the past to do some amazing things, and of course, they will continue to come together several times in the future to do amazing things. But the quintessential example is the invention of the stethoscope. The stethoscope was invented in the 1800s by a famous French physician who was also a musician. And at that time, the way to listen to someone's heart was direct auscultation, where you actually put your ear directly to the patient's chest and you listen for heart sounds. Now, you can imagine that that's not very good in certain situations. It does not respect personal boundaries, and it can be very uncomfortable sometimes for the physician and sometimes for the patient as well. Realizing we needed to have a better way to listen to heart sounds, and using his knowledge of sound amplification from music, he rolled up a piece of paper and realized he could hear better from further away by having that tubing that was created. And that led to the invention of the first stethoscope called the cylinder, which was a one-ear stethoscope. And now, of course, we're much more familiar with the two-ear stethoscope here on your left-hand side of the screen. Well, music and medicine now come together to form a field. It's called music therapy. In 1944, Michigan State University was the first college to establish a curriculum in music therapy. But music therapy really didn't start in the 1900s. It started back in 500 BC from the same Greek philosopher, Pythagoras, who described the mathematical exactness of tone. Pythagoras was quoted as stating, "Rhythm subsists within the mind, and the mind exerts a powerful influence over the health of the body." And by doing this, he showed us a very direct correlation of how music can actually heal, first by soothing the mind, and then the mind soothing the body. So he's considered the father of music therapy. In medicine, in the hospital, when we need to do research on patients, one of the most common search engines we use is called PubMed. When we put the search terms music therapy into the PubMed search engine, we get about 3,500 papers in the medical literature that provide scientific data showing that music can reduce blood pressure, heart rate, and the pace of breathing, decrease the perception of pain, diminish levels of stress, fear, and anxiety, and increase feelings of self-worth and ease symptoms of depression. So some very important scientific data already being published supporting the role of music being incorporated into the care of patients. Using the same PubMed search engine, when we put the search terms in music and cancer, we have over 375 papers that show up in the literature providing scientific data that music can help reduce chemotherapy-induced nausea and vomiting, enhance relaxation, diminish pain, and help patients and their families adjust to cancer. So again, some very important scientific data already being developed in the field of music therapy.